Today we're going to be talking about the three variations of spondy. There's spondylosis, spondylolisthesis, and spondylolysis. So the first form is spondylosis, and it's actually an umbrella term used to describe pain from degenerative conditions of the spine. People often forget that it's actually not a clinical diagnosis, it's just a broad term that refers to some type of degeneration inside the spine. Spondylolysis is the crack or stress fracture in one of the vertebrae. It usually occurs in the fifth vertebrae in the lumbar section, and it's the most common form of back pain in young children and in adolescents. The mechanisms for spondylolysis, it's still unsure of the exact cause of it. There's never been a documented case in a newborn, so it's not thought to be genetic. It's thought to be caused from sports that have repetitive stresses on the lower back, such as football, gymnastics, and weightlifting. The signs and symptoms of spondylolysis, there's often no symptoms at all. If they do show symptoms, the most common is lower back pain. The pain might radiate down their legs, and it will get worse with repetitive activity. The treatment for spondylolysis, initial treatment is almost always non-surgical, the most common being rest, so the patient's going to want to avoid sports and other physical activities that may heighten their symptoms. Anti-inflammatory drugs to help with pain and reduce the swelling, physical therapy, and oftentimes bracing. If spondylolysis is left untreated, it can turn into another form of spondylosis called spondylolisthesis, which is more severe. So spondylolisthesis is actually the slippage of one vertebrae forward with respect to the one below it. It mostly occurs at the lumbosacral junction where the L5 vertebrae slips over the S1 vertebrae. As the vertebrae slip, it may compress nerves located in the spine. Mechanisms for spondylolisthesis, the most common is going to be birth defect, overuse, arthritis in older generations, and loss of disc elasticity from aging. Less common causes of spondylolisthesis is going to be sudden trauma that leads to a broken vertebrae. You might see this in sports or even a car accident. Certain diseases and tumors can also weaken the spine and cause spondylolisthesis. The treatment for spondylolisthesis varies based on the severity of each case. Rest is the most common, medication for pain and swelling, back braces, and physical therapy. And then for spondylolisthesis, surgery may be required as a last resort. It will reduce the compression on the nerves. In the surgery, the doctors actually fuse the vertebrae to prevent further slippage of them. Rehab for spondy. A common exercise prescribed is the pelvic tilt. It helps decrease pain by stabilizing the lower spine in a flexed position. You're going to want to lie face up with your knees bent and feet flat on the ground. Start by flattening the lower back against the ground and engage the abdominal muscles to hold the position. You're going to want to hold it for 15 seconds before you relax and repeat up to 10 times. Another exercise prescribed is just the common crunch. Weak abdominal muscles often contribute to instability and cause pain in those with spondy. You're going to want to start by laying on the ground with your knees bent, your feet flat on the floor, and arms folded over your chest. Slowly lift the head and shoulders off the floor until a contraction in your abdominals is felt. You're going to want to hold that contraction for 3 seconds and then lower back to your starting position. And then once again, repeat up to 10 times. The signs and symptoms of spondylolisthesis are similar to spondylolysis. Oftentimes they'll show no signs and symptoms at all. Lower back pain is going to be the most common. Hamstring spasms, pain that spreads down legs and into your feet. And then the big difference between spondylolisthesis and spondylolysis is spondylolisthesis can oftentimes cause numbness and tingling in the feet, which is caused by the compression on the nerves from when the disc actually slipped. Some people show no symptoms at all. Hamstring stretches can also be a good exercise to alleviate symptoms of spondy. Tight hamstrings can oftentimes heighten lower back pain. You're going to want to sit on the ground with your legs straight out in front of you. Reach toward your toes until you feel a stretch in the back of your legs. Hold that stretch for 30 seconds and then repeat up to 3 times. Return to play for all variations of spondy. Physicians will often slowly introduce a patient back into sport-related activities 4 to 6 weeks after their first appointment with the physician. Intensity of activity will increase as tolerated by the patient. Return to full activity is only permitted after the athlete shows no symptoms and is able to perform full range of motion. The patients must also have full strength and balance before they're able to play again.